All right, I'm Brad Skiles. This is for the Nisly Prayer Page, and I'm with Bryan Spilmon, Dr. Bryan Spilmon. We're going to be talking in this episode about Mass. But before that, I need to set Bryan up and help you to know who he is. Some of you know Bryan. So Bryan and I have been friends for about 30 years. Bryan, I remember Bryan when he first opened up his practice and then moved into another building to develop a further practice. And eventually Bryan became in the top tier of dentists nationally. And Bryan, what was that? Is that based on production or revenue? How do they describe that?
That particular issue was on revenue, how much we were profit.
Yeah, that's here in Warsaw, Indiana.
Yes.
And Warsaw, Indiana has a pretty strong economy. And as a dentist, you benefited from that.
Yes.
Bryan was able to meet his goals really pretty early in life to be able to retire. So what I want to start with, Bryan, is having a very successful dental practice and having a staff that you worked with and, growing your business and eventually doing seminars to help other dentists know how to grow their business. I assume you were pretty busy. And what did that mean for you in terms of politics? Was politics something you were interested in and engaged in? How would you describe that?
Well, thank you for asking. First of all, the only reason I've had any success in my life is by God's grace. And that grace has shown up in many ways. And at that time, I had just a really, really successful practice, thanks to God. And my focus was on my patients and my business and being a good team leader and taking a lot of continuing education. And then that grew into giving seminars. And with that busy schedule, no, politics didn't fit into it. And somehow I had this kind of attitude that I put politics, down, like it wasn't really, it's something you see attorneys get involved with and you wonder, I don't know if I want to do that. But yet somehow I felt like overall the government was good and was working well. It's just not something I wanted to get involved in. And I had more important things to do and things that were, I think, better serving the community at that time than being involved in politics.
Okay. So let's fast forward. How do you think today about it?
Absolutely, completely different. As we get into this a little bit and we talk about healthcare and responsibilities, I see that I either through ignorance or laziness or arrogance overlooked my civic duty. It was my responsibility to be actively involved in my community, politics at the local level, at the state level, and the national level. And because I shirked that responsibility, in part, I'm responsible when we look at a government that has what we see now is just really unhealthy.
Mm-hmm. So we want to talk about Mass. That's why I asked you on, but there's a reason why I'm wanting to talk to you. So we need to define that. You're not just a typical dentist being trained as a dentist. So if I could just summarize it, there was a time in your life when you were a very good dentist. Then there was a time when you really almost turned that world upside down and began to think more natural health and holistic health. And then a third phase dealt with airway passages and things of a whole nother deal. So that's my layman's description. Give us your background that qualifies you to talk about airway passages and Mass.
Well, thanks, Brad. That's a very good explanation. I mean, I went from being more of a traditional dentist and then started to look at dentistry as part of a whole, the overall health. Some people call it integrative dentistry, biologic dentistry. But the bottom line is I was seeing how the mouth and the body work together. And then in that process, I discovered that there is this crucial foundation that's overlooked, and it has to do with airway. And the nose and the mouth are really connected with that. And so I've done a lot of continuing education in that area. And it's just fascinating. And unfortunately, it's not real common knowledge. So it doesn't get a lot of attention in conventional medicine or even in alternative approaches to medicine about how we breathe.
So I don't want to make this into a long discussion. Our intent here is to try to do something short that would allow somebody to get an executive summary of what you want to say. And then we're going to do a part 2 where we're going to dive in deeper. But this
Sure.
may be really helpful for people. You've told me that most dentists only are taught about this amount of the body.
Yes.
So in a real summary way, tell us how our teeth relate to organs and other parts of our body. Why is the mouth so important?
Okay, well, let me just back up just a little bit. And it has to do with, it's the way we are taught. It's the way we look at things. And in my early life, I spent a lot of time on my grandfather's farm. And if anybody's grown up on a farm, you know that common sense comes in pretty handy. My grandfather would call it book learning versus common sense. And I didn't realize what a blessing it was to have him role model common sense. And then when I went to college, I ended up going to a small university where I didn't understand it at the time, but that doctor was teaching critical thinking. And so he would open the class with, well, Mr. Spilmon, perhaps you can tell us. And when to answer his questions, it wasn't a matter of reading a book and having knowledge. You had to have the knowledge, but you had to develop understanding and discernment and exercise good judgment to come to the answers. So the important part of that is early on in life, I was taught how to think. But when I went to dental school, I was taught what to think. And that was a pretty traumatic experience because in undergraduate and with my grandfather, if I asked a question, they saw that as a teaching moment. When I asked a question in dental school, it was saw as sort of an attack or threat to their authority. And so it was responded a lot differently, and it became an unpleasant place for me to be. But I learned that I need to just repeat what they say. And what happens is you develop a great deal of knowledge, but you lack that understanding and discernment. I say all that to come back and say, okay, medicine as a whole, we don't look at the body entirely. We break things down into specialties. You may have a heart doctor. You may have a doctor that deals with digestive orders. You may have a kidney doctor. You may go to a skin specialist. Nobody really puts all the pieces together. And in dentistry, we focus primarily on the mouth. And we're sort of engineers. And I know it sounds funny, but, we're tooth carpenters and gum farmers. That's what we focus on. But the body is fearfully and wonderfully made, and everything is connected. And believe it or not, this is so hard for dentists to get. It's not hard for the general public, but our digestive health in our stomach, down in our gut, affects our mouth. And our mouth affects our digestive health. And now to the average person, if you say, well, it doesn't make, it's common sense that the digestive tract starts at the mouth. But for a dentist to think the health of the mouth may be impacted by the health of the rest of your digestive tract, and vice versa. We're taught, brush your teeth, be careful about what you eat, but the damage is done in your mouth. We don't think about the damage being done elsewhere in the body. And what I found is there's a connection. It is just amazing. It's like telling someone, well, the heart is connected to the rest of the body. They'd go, well, duh. Well, now we're saying the teeth and the mouth are connected. And years ago, when I started doing this research, I was amazed that there is a healthcare professional that has all this documented, and it is not your physician and it's not your dentist, it's the veterinarian. They've done a lot of studies on this to show infections in the mouth and how it affects the rest of the body. So if we're connected, you can find gum disease or other infections in the mouth, infected teeth that are connected to cancer, that are connected to premature low birth weight babies. A mother is almost at 7 times the risk of having a premature baby if she has active gum disease. Cardiovascular disease is directly related to the health of the mouth. It's pretty fascinating. And dentists are starting to catch on to that. But here's what's really exciting is what we overlook in the health of the mouth is how we breathe. Now, if you go to the Bible, it's amazing to me, after doing all this study, I just kind of stumbled onto it. When it said God created Adam, it said that he breathed life into his nostrils. And all my study would show that if you breathe through your nostrils, you promote life. And if you breathe through your mouth, you will create a cascade of events that will promote disease. The simple fact of breathing through your nose versus breathing through your mouth is crucial to your health. Does that answer your question?
You did. And I want to back up just a little bit. So again, as a person that really doesn't understand a whole lot about medicine, you're saying that what happens with internal organs and other parts of the body may have a connection to what happens with teeth and gums.
Yes.
Okay, so then with the other point, before we get to what you want to say about mass, the other point that I didn't know is my wife does a lot of research, and she was saying that so much of a person's health relates to your gut and your ability in your gut to digest food. And then when we talked to you about it, you said, no, that's not right. It starts somewhere else. So make the connection of what's important to the gut and how that all relates to what we're talking about.
Okay, so let's look at this kind of quickly, and I'll just give an overview. And when you simplify things, sometimes you leave some things out. But basically, this is it. Whether or not you're going to get a disease is primarily dependent on your immune system. So they call it the host immune response. It's not so much that you're exposed to a germ or a virus, but it's how your body responds to that. Well, 90% of our immune system, and this just, I mean, over the years has just continued to grow from somewhere in the 50s to now up into 90%. We believe that our immune system is related to the health of our gut. But the health of our gut, believe it or not, starts at the beginning of the digestive tract and is related to what goes in, not just through the mouth, but primarily through the nose. And so if you're breathing through your nose, you're going to set up a foundation that promotes gut health. If you breathe through your mouth, you're going to create a cascade of events that's going to cause it with every major organ system in the body, but it's definitely going to impact your digestive tract. Does that make sense, Brad?
Yeah, it does.
Okay.
So let's do this. Give us your thesis. Maybe before you do that, let me ask you this. You've listened to gobs of stuff, just like I've listened to lots of content. With what you think about in terms of all of your study and what's happening with COVID and mass, are you hearing people talk about the same things you're thinking about, or do you think you're going to bring something new to the table that we haven't heard?
I'm going to suspect that this may be new to a lot of the people that are watching this because it's really so overlooked. Now, if there's another dentist watching, what they may know is, and this is real current, is something they're referring to as mask mouth. That people wearing masks for extended periods of time, we're noticing that they have more dental disease, and that's gum disease and tooth decay, but also they're fracturing teeth. They're gritting their teeth, and they'll tell you that's due to the stress, but they're not telling you what causes the stress. What causes the stress is breathing through your mouth. When you put a mask on, you pretty much make yourself or provoke yourself to breathe through your mouth because it's harder to pull the air through your nostrils. So that's the term for that is called upper airway resistance. And so as soon as you put a mask on, you've created upper airway resistance. A lot of people have it just naturally. It shows up a lot during our sleep, and some people with severe cases would be recognized with sleep apnea. Or if you yourself snore or sleep with somebody that snores, you know, they're working to get breath. So when you put the mask on, it changes to a mouth breather. And when you start breathing through your mouth, you deprive yourself of a lot of things. When a person breathes through their nose, this is amazing to me, but the nose has 5 filters for air. The mouth has 1. It's just the tonsillar tissue in the back. Also, the nose, when you breathe through your nose, you produce a gas called nitric oxide. Dentists are familiar with nitrous oxide. That's a laughing gas. But nitric oxide is a gas that's produced elsewhere in the body, but primarily in the sinuses. It's a disinfectant. Now get a load of this. It kills bacteria, virus, fungus, molds. So by breathing through your nose, you're actually producing a gas that would kill a virus like COVID. Also, that gas is a dilator. So when it goes down into your lungs, it dilates these little pockets in the lungs called alveoli. So I want you to picture like a cluster of grapes. If you're breathing through your mouth, the body sees that as dirty air and it's going to contract. So your grapes have just become raisins. But if you breathe through your nose, the raisins expand and open up. They see this as healthy air. And so you have a more efficient exchange of carbon dioxide and oxygen. And it's really important because if you wear a mask, you can reduce your oxygen content but you can also elevate the carbon dioxide content, and that makes your blood acidic. And without going into a lot of detail at this stage, acidic blood leads to a lot of diseases. And of course, low oxygen leads to a lot of problems as well. If you're low on oxygen, your body will switch from making energy from something an aerobic approach to anaerobic. The anaerobic is fermentation. So if you're driving your car and you've got oxygen in the tank, you're getting 26 miles to the gallon. If you're having to do fermentation, you're down to 3 miles to the gallon. So it really reduces your energy, and it produces an acid itself called lactic acid. And that builds up and that causes acidic tissues. So your blood's acidic, now your tissue's acidic, all from wearing a mask for an extended period of time that causes you to breathe through your mouth as opposed to your nose. And I know I'm giving people more information than they want to know.
Okay.
Get a little passionate about it.
So I think we see where this is going. You're going to tell us that wearing a mask is a problem. Why don't you discuss your view of children wearing masks?
Okay. Well, again, let's back up just a second here. When I was talking about learning how to think versus what to think, I would ask the people that are watching, I don't want to tell you either one, how to think or what to think, but I would ask you to just think about how you come to the decisions that you come to concerning your healthcare. And one thing I would say is you have to weigh the risks and the benefits. And people may say, well, a mask may or may not work, but they don't really cause any harm. If you wear it extended for several hours, it can cause a great deal of harm to the adult. Just like we said, it's going to affect every major organ system. I just talked about airway and blood. It disrupts your digestive tract. It throws off your hormonal balance. It creates neurological disorders. I mean, we're talking, it's serious stuff. But when you put a mask on a child, I want you to just bear with me. I'm going to exaggerate just a little bit, but pinch your nose together. You can't breathe. You have to open your mouth. The moment you open your mouth, your tongue comes off the roof of your mouth. It's the tongue being on the roof of the mouth and pushing against the roof of the mouth when you swallow that causes your face and jaws to grow and creates an adequate airway. So when a child wears a mask for an extended period of time, you're going to disrupt their craniofacial growth and development. Naturally, these children are going to have more narrow arches and crowded teeth, but that's not the problem. The problem is there's a window of time for certain things to happen, and they may not be able to reverse the effects of wearing a mask. They may develop a dysbiosis, an imbalance of the bacteria in their digestive tract that they won't be able to get back. Now, some people think maybe you can, but no, there's a certain level, there's a window of opportunity. And if that window closes and things are underdeveloped, you can't regain that. And so that's just on the digestive tract, of course, which affects 90% of your immune system. But then it also affects the way the face grows, impacts our skull, something called the cranial base, that what our brain sets in. So then the space that our brain occupies will not function properly. And this leads to neurological disorders. And so when you talk about things like brain fog in adults, or Alzheimer's or Parkinson's or even dementia, imagine now speeding that up so that children start to experience neural inflammation at a very young age. And because of the growth of their face and cranial base, they may not be able to detoxify themselves correctly. So it's very, very dangerous to have a child wear a mask that causes them to mouth breathe for an extended period of time. I hope I'm not going into too much with this, Brad, but it's very, very serious.
Well, I think the benefit of this conversation is you got to keep the cookies really low for me. So at what age would a child not have as much of a concern in your mind with wearing a mask? I mean, it sounds to me like there's a period and a window where there's lots of development, and then they would reach a stage where most of that development facially, the skull, etc., is fully developed. So what is the window that we're talking about?
Well, if you're in your late teens, you're going to see most of that development naturally. Now, I'm not saying that we can't train. I mean, adults use braces and they can see changes, and we can move the teeth, but we can also grow the jawbone. But primarily by the late teens, some things are kind of set. And I would be really concerned, especially to see young children in elementary school or just beginning high school, that can create some problems, really serious problems. So
And
I don't want to see elementary students in a mask for extended period of time. I'm not talking about putting on a mask to walk through the front door of a restaurant to get to your seat. I'm talking about 4, 5, 6 hours at a time when you're in school, something like that. That would not be beneficial to their overall health or the growth of their craniofacial growth and development.
yeah, so someone else might talk about the psychological impact of wearing a mask, right? That's not what you're talking about. You're talking about the physical development as one issue, and then you're talking about the actual health of a person by not being able to have enough oxygen or not breathing through the nose. Even an adult would have health risks, but a child, in addition to that, would have developmental structural issues related to the skull and breathing passages and all of that.
Yes, exactly.
And once that sets in, then you're talking about a lifetime, pretty much, experience based on somebody wearing a mask as a child.
Right. So imagine you wear a mask for a child while you're going to school through a particular semester, and you're wearing it 4 to 6 hours. And now for the rest of your life, you're going to have a disease process set up inside your body that you may not be able to reverse. You're always going to struggle with something like this. We may be able to correct some things, but some things may not be able to be corrected.
So Bryan, this gets kind of deep, and I know maybe we're going down the wrong road here, but I know from personal experience that you've done MRIs and can tell whether a breathing passage is, I'll just say, healthy and the appropriate size, or whether a breathing passage has been restricted. And
Yes.
I'm thinking what you're talking about is that if the skull and jaw and facial structure is not developing correctly, that impacts the size of a person's breathing airway. Is that right?
Yes. Kind of think of form and function together. You know, a doctor by the name of Felix Liao wrote a book. He called it the 6-foot tiger, 3-foot cage. You know, you're trying to put this tongue in an area that's reduced, and it has to push back, and it closes off the airway and causes different problems. But yes, you're creating a structural problem that's going to lead to a functional problem that overall will promote disease.
Yeah. So I'm thinking that if what you're saying is right, and in the year 2020 and 2021, we're doing things and, quite frankly, forcing people to do things, the consequence of that may not be seen for multiple years or perhaps even decades, but it's impacting people's health today that will create consequences into the future.
Yes, it may be hard for some people to connect the dots, but when they look back at it and look at the whole, they'll see, oh, this person was forced to wear a mask. It promoted mouth breathing over nose breathing. They develop certain craniofacial deformities that then affect the rest of the body. And then their body doesn't function properly. And then they're going to have other issues that show up. And we're just going to see that next generation is going to be much more susceptible to chronic diseases and autoimmunity.
So on our site of Nisly Prayer Page, there's lots of activists and some women, mothers, who are very engaged in, Purple for Parents, which is trying to bring, we'll just say, common sense to education, right? I was going to say morality, but it's more than just morality. We also have another group of women on this prayer page that have been very involved in vaccines and, trying to say, hey, we want more medical freedom.
Yes.
I would think that we're deep enough into politics on this page to be connecting the dots and recognizing that in the average community, we'll just say Warsaw, there are school board members and then superintendent of school and principals that have no knowledge of what you just said. Does that make sense?
Oh, absolutely. Right.
So I would think if I don't have children, if I was a parent, I would be freaking out listening to you. And I would be concerned that there are people dictating decisions about wearing masks and what should be happening, that on a scale of 1 to 10 of understanding the situation are a 1, a 2, a 3 or something, and they're not understanding that they're promoting something and creating public policy that has huge health ramifications that they are completely unaware of.
Yes, that's correct. And it is unfortunate because you're not going to find this information. Most of conventional medicine doesn't pay attention to whether you breathe through your nose or your mouth. They just want to make sure you're breathing. And even alternative medicine doesn't look at that as a whole. But we're beginning to see some people are starting to pioneer this area. They tend to look at it through sleep medicine, but it's you breathe the same. I mean, at sleep, it's important, but also during the day, it's the same thing. So people are being made to they're being asked to make decisions, and those decisions have certain benefits and certain risks. But there's a lot of risk that people don't understand that they're taking. And one of them is children wearing a mask for a prolonged period of time has tremendous health risks, and some of them may be irreversible.
So again, from my perspective, which is pretty limited, I'm hearing you and knowing other discussions we've had. One application of this would be fast forward 20 years, 30 years, we may see more people with sleep disorders, not, we would call it sleep apnea, but that relates to the airway passage and whether it's restricted or healthy, I guess I would say. So in my lifetime, in your lifetime, this has become a big deal. There's more and more people that have sleep difficulty. Now we're using sleep apnea and CPAP machines. But what you're saying, yes, we're setting up the population in general that we would likely see more people with those difficulties as they continue to age because their facial structure did not form correctly because they were wearing a mask.
Well, all the people you described as adults, that's what happens by the time they get to adult. Those seeds for that tree were planted when they were children. Mm-hmm. Those people, and this is just something that parents can look for, but bedwetting is going to be related to an airway issue. And you're going to look at these children have disturbed sleep, but over a period of time, as they become an adult, then they just start to develop these diseases that are recognized at the conventional medicine. Will recognize sleep apnea. You can have a child check for it and they'll see it, but they don't really start to look at the diseases that come out of that until you start to reach adulthood. And yes, so we have a lot of people that have that problem right now, and now we're putting masks on children, and so we're just going to see those rates skyrocket. They have skyrocketed, but those adults as children had airway problems. Now we're forcing most of the children to develop an airway problem, unfortunately. And I don't think we understand the risk we're taking.
Right. So,
and we certainly don't see the benefit for a child when you look at the statistics related to something like COVID. Children are not normally at risk for death related to COVID.
So we're going to wrap this up real quick. We've already gone longer than we thought.
Oh, okay.
Come back in a part 2 and delve down a little bit deeper. Okay. So I know you are concerned about putting so much content into one session that it gets too long. What's coming to my mind, Bryan, is that in my side of my world, I think about the economy, finances, free markets. So from a financial side, we would say central planning doesn't work. Right. We have socialism, which is trying to plan the economy. And we have what we call central planners who are deciding what farmers should plant, how much prices should be, et cetera. And then we see essentially socialism and communism as failures against the free market, where our founders, the founding fathers, had the view, just get out of the way and let the free market develop. And then that will be a healthy economy, right? Versus central planners saying, no, we're smarter than the free market. we can plan things right. So let's make the interest rate at this level. Let's do whatever. Okay, so you get the idea, right? So I'm thinking what's happening today is that we have central planners dictating these health issues, and much like socialism or capitalism, much like socialism or communism affecting the economic free market, we have these central planners who have no idea what they're doing, who are dictating public policy about wearing masks and whatever else is out there, social distancing or whatever. And in a sense, would we be better off if instead of central planned healthcare, we had free market healthcare? In other words, if we weren't requiring masks, would that be a better situation than these bureaucrats dictating what they think the solution is to fighting COVID?
Well, let me give a little bit of a long answer. Healthcare gets a lot of media coverage, so let's define it. The deeper, more authentic definition of healthcare is cultivating a sense of responsibility on the part of the patient for his or her own well-being. Let me say that again.
Yeah.
Healthcare is cultivating personal responsibility. So who's responsible for my health? I am. Who's not responsible for my health? Believe it or not, my healthcare provider is not responsible for my health. They're responsible for the healthcare they provide. My employer is not responsible for my health. They may be responsible to create a safe environment, but they don't need to do things for me that I can and need to do for myself. My health insurance coverage is not responsible for my health. Now, let me go one step further. These central planners at government is not responsible for my personal health, but I am responsible for the personal health of the government. So when you look at responsibilities and you talk about healthcare, healthcare is never something you do to people. Occasionally, for a limited time, it's something you might do for people, but it is always something you do with people. There are shared responsibilities. And when you violate those natural laws, like you've talked about in communism and in socialism, you see failure. Well, when you violate those laws, those natural laws for people, that's not healthcare. And they're going to no longer exercise the freedom of personal responsibility, but things are going to be mandated on them and forced upon them. And unfortunately, they're going to suffer the consequences because someone else made a decision that they really weren't in the position to make that decision. We should each cultivate personal responsibility and make decisions for our own health and well-being. That's healthcare. I don't know if that answered your question, but it let me get up on my soapbox and preach.
That was very good, Brad. All right, so I think we're going to wrap this up for now. We'll come back with a deeper even discussion, and eventually, I don't know when we'll do it, but we also want to talk about vaccines. But I guess where I want to leave it, it's kind of alarming. I'm still stuck on this idea that I know people in my community who are medical doctors, school teachers, even business owners, school board members who have no idea of what you are talking about. And so they think, we'll pick a business owner, they think by mandating that they're, like, we'll just say 20 something employees. My wife and I will go, I'm sure, in the next couple of days to TJ Maxx. Those are 20 something year olds who are wearing masks, I don't know, 6 or 8 hours a day. It's absolutely crazy. And the business owner doesn't understand it and doesn't feel liable for what he or she is doing to those employees, right? I mean, that should be a concern. It should be alarming. The principal or the school teacher who's being obedient and following public policy is not understanding how they're affecting these children for the rest of their lives. And I would hope that as parents watch this interview, they're completely scared, realizing, oh my gosh, these people in authority have no idea what they're doing, and they're affecting the future as well as the current health of my children. I mean, am I overstating or exaggerating the concern?
No, I'm sorry, I get worked up about it, but absolutely not. Yeah, I mean, I want to forgive these people because of ignorance, but still their ignorance is going to cause irreversible damage to people. And it's, we said that like an employer is not responsible for my health, but they are responsible to create a healthy work environment. And people are going to suffer, even through ignorance. And I'm not faulting anybody with that, but you have to weigh the risks and the benefits. And so when you look at a certain segment of the population, the risk of them dying or get seriously ill from COVID is really low, especially for children. And then you look at the risk that you create by putting on a mask. You have to think and weigh the benefit and say, my goodness, it's almost like the treatment is worse than the risk of the disease. And it is in this case, if you're going to wear a mask for an extended period of time. Yeah. And here I'm casting aspersions, but when it'll really take off is a few years down the road, and another profession will become aware of all this, and that's the legal profession. And the attorneys will cut loose on these mandates that have been forced upon people, and then look at the devastating health effects it's had on people. And boy, we're going to see this showing up in the court system down the road. Whether you meant to hurt somebody or you didn't, they're going to hold you accountable in a court of law for all this damage. And ignorance is no excuse when it comes here. You can say you didn't know, but you have to weigh the benefits and the risk. And I would ask people, don't take my word for it, but do some research on this. It's very significant. You might have to dig a little bit. You and I talked about putting some links on the next interview. So if people want to go down deep, where they can get this information, because it can have a devastating effect on someone's health and their life.
Okay, so it would be awesome if we could say, all right, this is kind of depressing right now, so here's the hope. but that's not how this is going to end in this interview. And I don't know that the next interview is going to say, okay, here's the solution. I mean, the solution is get the government out of our lives. But the reality is, this is too big of a topic. We're too far down the road. There's too many people who are just following this public policy, which has no consideration for the health impact. I mean, I don't want to just be, depressed and dismal, but I guess we're going to end this part of the interview with a very serious tone that this is not a good situation, and we might call it a crisis in a sense. And I don't know, is there any other way to say it? How do you want to end?
Well, there is something good that comes out of this. What we're learning is you should not let other people make decisions that affect your personal health or your children's health. You need to be actively involved, and we should fight for that freedom to cultivate personal responsibility, to have a choice. It should not be mandated on us. And so there's the hope, is that even though with everything that's going on, we're understanding we can't rely for other people to be responsible for our health. We have to take personal responsibility. And as we educate ourselves, we'll see that there is tremendous hope that's based on truth. Unfortunately, a lot of what we're receiving is misinformation or half-truth. And some of it is disseminated unintentional, and some of it, I know that people have to know better than what they're saying. But the bottom line is there's tremendous hope once you get educated on the truth, and once you realize that you're personally responsible for your health, and don't give that responsibility to anybody else, but fight for it to make sure you have that freedom for health care at a personal responsibility level. Does that make sense, Brad?
It does, Brian. And part of where I think we're going to go next time in part 2 is, obviously, we know each other. We've talked a lot about this. I think there's tremendous hope when we really talk about COVID and the seriousness of COVID, and how to have a high probability that it's not going to have a detrimental effect to a person's health. So all we've been focused on today is the mask. And in a sense, the hope is don't wear a mask, or do it very limited. But what I want to say is I'm still worked up that the topic is very deep and very serious, because people don't understand the ramifications of what people are doing. So I want to get into that a little bit more next time. But I also want to move from, I believe that we can do a conversation where if someone is fearful about COVID, they're going to understand that's a false sense of fear. Would you agree with that? Should people be concerned about COVID, or should they be, I don't know, not concerned? Let's say that.
Well, Brad, I'd have to know what their specific fears are. If their age group, if it's for them, if it's for their children, if it's for an elderly parent, what the condition is of those people. I mean, there are things that compromise our immune system that put us at risk for any type of disease. So it would have to be specific. I'd want to know their fear and then be able to address it from an area that would at least reduce the fear by giving them the truth to do things that would promote their health or protect their health. And unfortunately, the things that are being promoted like right now are not things that are going to protect your health. I mean, we can talk about that later, but you can go to the Center for Disease Control's website. I believe their organization is NIOSH. Those are who regulate masks and respirators. And they'll explain to you that a cloth mask or surgical mask are not rated for respiratory protection. That means you can catch something through a mask. There's some controversy on source control, but wearing a mask is not going to stop you from being exposed to the germ or the virus. It's just not going to happen. So then what measures can you take based on your risk factor, where you are in a risk group? That would be something to do. And I'd be happy to, address those. Now, my professional opinion would be, it comes into the airway issues and craniofacial growth. I'm not an immunologist and I'm not a physician. I can tell you some things that I believe would help, but that'd be my personal stuff.
Yeah.
And as far as hope, I should have mentioned this. This is Curt Nisly's prayer page.
Yeah.
And our hope is that God continues to work in people like Curt to help protect us at the government level so that we can exercise healthcare at the personal responsibility level. We do have a lot of hope because we have people like Curt Nisly. I've come to know Curt. I've been blessed in many ways, but that blessing usually shows up with people in my life, like you and I in our friendship for so long. And I've come to know Curt in the past 6 years, and he's a man of what I would call character ethic and character strength. He knows right from wrong, and when push comes to shove, he will make the right decision. Unfortunately, that's not common in politics. And I think we do have a hope that God will put more men and women in politics through our personal responsibility to elect trustworthy individuals. And then they can protect our rights. And one of those rights is the freedom to exercise personal responsibility when it comes to our healthcare. We shouldn't have things mandated, especially a mask, or if we do get into it down the road, a vaccine. We have to know the risks and the benefits.
All right, Bryan, this has been really good. It's been disturbing. It's been disturbing, but it's been very good. Thank you.
Well, there is hope.
Yeah. Have a good night. Thanks.
All right. Thank you, sir.